Hello YouTube, this is Timothy coming to you for the Monday edition of my lap band journey. I have a few things this week to go over with you. This week we are using the topic of pre-op worries. Um, my lap band journey started on August the 10th of last year, it's the day I had surgery. And I had a lot of pre-op worries, basically not only because of the surgery, but because I was going abroad to have my surgery completed. Um, some of the worries that I had was medications, taking medications after the surgery. How would that work? Would they get stuck in the band? Or uh, basically how do you take your medications after the band? Because at the time I had my surgery, I was taking a variety of medications, and then after the surgery, you have your vitamins that you have to take on a daily basis after the surgery to help you along your lap band journey. One of the concerns also had was band slippage. When trying to make my decision on what type of surgery I was going to have, gastric bypass, gastric sleeve, or the gastric band, one of the worries that I had with the band was the problem of slippage. What if I was one of the patients that my band did slip after paying all of the money, because I did pay for my surgery out of pocket, no medical insurance involved? What would happen after my surgery if my band slipped? How would I get it replaced? Would I have to pay for it to be replaced? So one of my concerns was band slippage. Um, Another one that I had was border crossing. Like I said, I did go abroad. I went over to Mexico to have my surgery done, so I was concerned about how I would get across the border and back in, or across the border for my surgery, and then back into the U.S. after my surgery was completed. Also had the worry of infections, not only because I was going abroad and I've never went anywhere other than here to my local hospital to have surgery done, but I was concerned about infections. Um, how would I deal with infections once I got home if I got an infection? Because it is somewhat harder to get a doctor to see you once you went abroad for surgery, if it's to deal with that surgery. And then, of course, there's the big one that I had was surgery complications. That was the biggest worry I had because of the fact that I had no one that was going with me other than my partner, Chris. None of my family was going with me, so how would I deal with any surgery complications without any family there to make medical decisions for me or anything like that? So the five major uh, pre-op worries that I had was surgery complications, infections, band slippage, medications, and border crossing. With that being said, I will say once I got to California, the Hospital Angeles, did pick me up and escorted me across the border, which was no problem. So that worry was gone. Once I got across the border, there was no problems getting across the border. Basically, I was in the hospital vehicle, showed my passport. We went kind of through an express lane, showed my passport, and was able to get across the border without any complications whatsoever or anything like that. Uh, the next one, infections. Once I got across the border, got to the hospital, seen how clean the hospital was, and when I say clean, the hospital over there, Hospital Angeles, was clean. The nurses was great. I had no more worries about infection other than when I got home, taking care of the wounds myself. but worried about getting an infection while I was there at the hospital. No worries. The hospital was clean. They were constantly cleaning on a every few hour basis. There was someone in my room checking to see if something needed to be cleaned. So once I got there, I seen the hospital. I don't know what else to compare the hospital to, but to me it was kind of like a 5-star hotel. Only you just had your personal nurse that came in to check on you and make sure everything was going good and that everything was clean. With the medications, once I got there and I spoke to the doctor and whatnot, and they explained that you would crush your pills up before taking them, or either you would get chewable pills. Everything was fine after that. With the band slippage, that's probably a worry that everybody has, because that's not something that you have control over, or I have control over, or the doctor has control over. That is a risk that you are taking when you are having the surgery done. All you can do is find out and educate yourself on what you can do to prevent band slippage, to prevent this situation before it happens, because there is things that you can do that can prevent from your band slipping. And then with the surgery complications, that's a worry I had up until my surgery was over, just because of the fact there was no family there. I had no one there, except for, like I said, except for Chris. And that was just one of the biggest things that really concerned me, because I've never been into a type of situation without my mother being there or some part of my family. Every surgery I've had quite a few. I've always had my mother there, and I'm kind of a mother's boy or a mama's boy. So that was one of my biggest fears, was the surgery complications. And like I said, I had that fear up until after my surgery was over. But that was my pre-op concerns, my pre-op worries. Other than that, I really didn't have any worries. I had some concerns with, I am a smoker, and I had to quit smoking 2 weeks prior to surgery in order to be able to have the surgery done, and I was worried about not being able to quit, but I was able to stop smoking for that period of time, 2 weeks prior to my surgery up until my surgery date, and until I got back into the States, I did stop smoking. So that is my pre-op worries that I had. We all have our different worries, but those are the 5 basic things that I worried about. Once again, it's infection, band slippage, medications, border crossing, and surgery complications. But other than that, I really didn't have any worries. I did a lot of research on the lap band surgery. I did a lot of research on the hospital and the surgeon that I chose. I would say I did about 6 months worth of research before, well, more than 6 months, probably 7 months. I started researching the lap band and Mexico in January of last year, and I did not book my surgery until July. So I did a lot of research and careful thinking before I did choose to go ahead and book my surgery with the hospital over in Mexico. I hope this does help people out. I hope these daily blogs do help people out, even if you've had surgery or if you're looking at having surgery. This is a great way to educate yourself, because a lot of my education came from YouTube videos like Banded Wendy, Miss Gigi, Sherry Luca. There's just so many that I can't remember all the names of the videos that I watched prior to having my surgery. So my name is Timothy. My YouTube channel is tpearce3102. That's TPEARCE 3102. You can check out my personal blogs there. Otherwise, I hope you guys are having a marvelous Monday, and I will talk to you guys next week. Once again, this is Timothy, and I am your Monday vlogger for my lap band journey. And you all have a wonderful afternoon. Bye.